Okay, well, we will just go ahead and get started. And as people join us, we will just kind of at the end mention that this is being recorded. And so we are happy to share the entire presentation with you if you would like that. Anyway, so I'll get started. My name is Dr. Stephanie Norris. I am the owner and founder of Healing Pathways Collective. One of my areas of expertise is autism spectrum disorders. So I conduct autism evaluations and I do therapy for the higher functioning kiddos and adults. And I am here with.
Hello, everyone. I'm Betsy Hart, and I'm with Handprints Therapies. I am the founder of Handprints and also an occupational therapist. And I've had the opportunity to work with many families navigating therapy services after they've received a diagnosis or even after they simply suspect something is just not quite right developmentally. And I am happy to be here with two incredible leaders from Handprints Therapies, and I'll let the two of you introduce yourselves. Jessica.
Hi, I'm Jessica Textoris. I'm the Regional Director of Operations at Handprints Therapies. I've been with Handprints Therapies about 6 years, and I'm a BCBA by trade. Been a BCBA for roughly 15 years and have had the opportunity of working with kids all from, as early as 1 all the way through adulthood. Alexis?
Hi, I'm Alexis Powers. I'm the Regional Director of Clinical Services at Handprints, and I'm also a BCBA. I've been with Handprints for about 8 years now and have worked with kiddos from 2 to 21. Yeah.
Excellent. Thank you. Just a quick overview of our evening. Stephanie will begin with an in-depth look at the diagnostic process, followed by our Handprints team discussing the navigation of therapy services, how they work together, how to pick what is right for you and your child. And as Stephanie mentioned, we are recording this and we are going to leave a lot of time at the end for Q&As. So feel free to put your questions in the chat throughout the presentation. We will turn off the recording or at least delete that portion to allow for some candid questions. We really want to be supportive and resourceful to all of you throughout this presentation. And Stephanie, do you want to talk a little more about the roadmap?
Yeah, so we're going to start with the diagnosis, symptomology that maybe has led to some curiosity. Does my kiddo or do I myself have autism? We're going to talk about processing the news, learning about it, what therapies and kind of services are next, and building a support network, which is a pretty significant component when you are diagnosed with autism. That's both from a familial perspective, family, as well as the services that are going to be recommended in the evaluation. And then we're going to end with planning for your future. Like Betsy said, we're going to do questions at the very end. You are being recorded. You're welcome to turn your cameras on, off, whichever you prefer. Please put questions in the chat. I always say there is no stupid question, okay? Please. That is what we are here for. We're really here to help you guys to navigate or to understand or get some clarity if that's what you're looking for. So we're super excited to be here. We're so happy that you joined us. So I'm going to do a deep dive into understanding and evaluation. I'm going to highlight what's the difference between a quality evaluation for autism and one that's maybe not so high quality. I'm going to talk about questions that you can ask your evaluator, and this is ahead of time. So as you're calling to get scheduled, these are questions that you want to ask ahead of time. I'm going to talk about the diagnosis, specifically symptoms, and when you are diagnosed or when your kiddo is diagnosed or a family member is diagnosed, and then what happens after that? That's the big question here. What do we do with a diagnosis? And when you should pursue a diagnosis. So that is the coverage I'm going to do all about evaluations this evening. Then I'm going to pass and they are going to talk about therapies. So let's talk about signs and symptoms of autism. So we have what's called the DSM-5, which is the Diagnostic Statistical Manual that basically highlights the criteria that we have to identify in an individual that has autism. But we also have manifestations of autism. So just generally speaking, you can think of those as just like these are very common behaviors, common symptoms of somebody with autism. And it is more than likely if they are engaging or if they are experiencing or exhibiting any of these behaviors, they probably have it. And so developmental delays is very normal for autism. So this would be kiddo struggles with walking, talking, speech, and potty training. Those are the top four developmental areas that an evaluator, someone like myself, and or a therapeutic service like Betsy's is going to look for because it helps me to identify, do they have autism? Is this indicative of autism? Or maybe it's indicative of a genetic disorder, which I'm going to cover later on. Or is it something entirely different? It also helps Betsy and her team to identify maybe some of the specific therapies that need to help. Maybe we need additional speech therapy in there. We need occupational therapy for potty training and for walking. We need physical therapy maybe. So that developmental delays, very normal, very common. And it's not uncommon for a kiddo to start talking and using words. We call them one phrase words or one approximation words is what we technically call them. So they're going to say mama, dada, bottle, um, baba. They're going to say something like that. And then to have a period of regression. That is very normal. So you could say, well, my kiddo was talking at 9 months and then suddenly stopped talking. Very common with individuals with autism, just so you know. It's also very common for a kiddo with autism not to walk until they're almost 3 years old or 2.5. So those are some things that you maybe want to look for when you're thinking about, or if you're an adult, maybe ask your mom or dad, did I do any of that? Did I have any delays? Very normal. Repetitive restrictive behaviors and social interactions, those two fall within the DSM-5. So that is the criteria that we are looking for. Repetitive restrictive behaviors is someone who is engaging in only playing with cars, or they flick the baby doll's eyes. That's very common. Or they spin the wheels on the car, or they line up cars in a row, or they line up objects in a row, or they talk about a subject and they talk about it and talk about it and talk about it, and they know absolutely everything there is to know about semi trucks or the ranger in the forest or anything like that. That is a very normal thing for individuals that have autism, or they do activities. Restrictive repetitive behaviors is also an activity, and they do it over and over and over again. And they have a hard time with it being interrupted. So you can't really interrupt them because they typically will have a pretty low frustration tolerance, is what we call it. I'm going to get into that later. But that is a pretty normal sign and symptom of autism where an individual just gets frustrated very quickly. And that's simply because they can't tolerate change. They can't tolerate like their routine being different or being told they can't engage in this restrictive repetitive behavior. Social interactions, very normal. They struggle. They don't know what to say. They are literally in a social situation and they are like, all I want to do is talk about the wheels on my car. That's all I want to do. I do not want to hear about this. I do not want to talk about this. And then they often will get into your physical space. So they will literally put their body in your space as a mechanism to say to you, hey, I'm ready to speak. I'm ready to talk. That is all normal for an individual with autism. They often struggle with eye contact. They struggle with reciprocation. So that means back and forth conversations. They struggle with asking you questions about yourself. They typically don't. They will only focus on themselves. Again, super normal, you guys. And the last bucket is sensory issues. Very normal for them to struggle with loud noises. They get scared very easily, or materials like jeans. They typically will go through a phase where they will not wear any jeans. They will only wear cotton. They will not have tags on them. You will have to cut the tags off because the tags will irritate them. They will have to have maybe like a fuzzy or a stuffy. They'll rub your hair maybe against their face. So if you have longer hair, they'll kind of take it and they'll rub it. They may rub certain like objects, if you will, like if it's a fluffy or something very soft, pillow, those types of things. So those are all very common in a very large kind of general 10,000-foot view, signs and symptoms of autism. So let's talk about a quality ASD evaluation. An autism evaluation requires what we in our field of psychology calls standardized measures. So a standardized measure simply means that we are giving the test or the assessment or the measure, they all mean the same thing, in the same exact way, meaning that if we are sitting across from them or we are sitting next to them and we are asking it in the same way, we're using the same words, and those standardized measures are normed on specific populations. Now, within autism evaluations, they are normed on individuals with autism, and that helps us to identify if your kiddo has autism, or you yourself as an adult has autism. And so autism measures can and should include, we have two kind of gold standards, if you will, for autism evaluations. And so one of them is called the ADOS, ADOS. That is a gold standard for autism. That is the measure, if you will, that helps us, meaning evaluators, pull out symptomology of autism. We also have cognitive testing that needs to be done. Cognitive measures are standardized measures as well, and they tell us if they maybe have a cognitive deficit. So maybe it's intellectual developmental delay. Back in the day, that used to be called mental retardation, and now we call it IDD. And somebody with IDD often does present very similarly to someone with autism. So we need to do a cognitive measure. You want to have an IQ test done to be able to determine if this is really a cognitive issue or is this an autism issue? Because it's going to help the evaluator to differentiate between the two. There's also other ASD measures, such as like social measures that we have to do, that are standardized on an autism population. And that helps us to pull out those social interaction skills, just so you know, and the problems maybe that they are having or deficits. The ASD measures help us to pull out those restrictive, repetitive behaviors that I talked about before. And then we have mental health measures because it is so common. I'm telling you, so common for somebody with autism to also struggle with depression. Social skills and having deficits and not having a lot of friends is really, really upsetting. And that can often lead into depression. We also can struggle with anxiety. Now, anxiety is a part of an autism diagnosis, just so everyone knows. That is very normal. So we don't always struggle with generalized anxiety disorder or have an anxious disorder of some sort, but it helps pull out those mental health symptomologies that perhaps that individual with autism is struggling with. So these are some of the measures that I just spoke about. So the ADOS, that's our gold standard for autism. The ADIR is another gold standard for autism. The SRS, that's our social measure. So that's going to pull out some of those social interaction issues. The ASRS is pulling out the actual diagnostic criteria of autism. The Vineland helps us to identify, are there adaptive behavior issues happening? And that is the walking, the talking, the potty training that I spoke about before. That's your developmental delays. So that is the measure that's going to pull out those for the evaluator to determine where that kiddo may fall given his age. Cognitive measures, these are the IQ measures. So the WIPSI, the WPPSI is for the littles, those for the itty bitties. And the WISC is for your elementary and up kiddos. And then the WAIS is the standardized measure WAIS for adults. And that is going to give us an IQ. Again, that's identifying, do we have IDD, intellectual developmental delay, and that's our problem? Or is it really autism? So these are some really important questions. So when you're calling around to schedule an evaluation, I have just kind of put some questions out there for you guys that is important. So what can you expect? That's a really important question, especially if you have a kiddo with you or if you yourself believe that you have autism, because that helps to decrease anxiety for everybody involved if we just know what to expect. So it's a great question. Typically, what happens is you will come in, you will do an evaluation, and they will give you maybe 5 to 8 measures, meaning assessments. It just depends on your age. Sometimes it's less than 5. So I can test kiddos as young as 2 months old and all the way up to 100. And so obviously a 2-month-old, I'm not giving very many measures, but I can absolutely do an IQ measure on a 2-month-old. Again, not, it's valid, but it would be redone in the future as kiddo aged. How long does it take? That's a great question. Typically it takes anywhere from 2 to 5 hours. Again, that depends on age and that depends on how many assessments you're actually taking. But that helps prepare you. Are there breaks? There should be. We should be taking breaks along the way. And so you are the client, so you can ask for that if you need it or if you feel like your kiddo needs it. But there should be breaks that are taken because individuals with autism can get overwhelmed very quickly. And that's part of that low frustration tolerance. What types of measures are being used? That's a very important question. If we're not using the gold standard, then we're not really testing for autism, to be honest. You want the evaluator to use the gold standards of the ADOS, the ADOS, and an IQ measure. Those two should absolutely be done because that is going to help you to identify, again, the difference between is it cognitive or is it autism? What's the turnaround time for the report? Should you guys expect it in a month, 2 weeks, a year? Like, when should you expect it? That is very important because typically you want to get services right away if you or your kiddo is being diagnosed with autism. Can you assist with school interventions? So many of us as evaluators do. We help parents who maybe are struggling with like a school introduction or trying to get an IEP. Betsy is going to talk about that later, but it's an independent education plan. And that becomes essential in the school system for a kiddo to have. And so does the evaluator help you with that, or are you supposed to go elsewhere for support and resources in that regard? And then do you provide feedback? Does the evaluator go through the entire evaluation with you, and what exactly does that look like? That's really important. So for example, when I test somebody, I go through the entire evaluation from page 1 to the very end to help the parents understand either why I diagnosed or maybe why I didn't diagnose and I diagnosed something else. So we have an ASD diagnosis. What does this even mean? Well, it means that your kiddo is struggling with those restrictive, repetitive behaviors, or you yourself as an adult. It means there's social interaction issues. And within the evaluation, there should be some pretty specific recommendations in regards to what should that person do next now that I have an ASD evaluation. So, for example, when your evaluator is going over feedback, and if they don't say this, you should ask. You should say, hey, what should I do first? Who should I call first? Should I be doing ABA therapy? And all of these acronyms that I'm about to say, Betsy is going to go into grave detail for. And so bear with me as I just spit them out. But should my kiddo go into ABA therapy? Should my kiddo be in home? Should my kiddo be in an office setting? Should my kiddo get occupational therapy? What comes first? Should I do occupational? Should I do ABA therapy? Should I be reaching out to the school first? It's very overwhelming for parents and even an adult. What do I do first? And so that is really what you can expect with your diagnosis in your evaluation. There should be very specific recommendations, and you are the client. You should ask, what do I need to do first? Please help me. And then what should I do? And then what should I do? Because there should be a whole list of resources out there in your evaluation, I mean, to assist you based on the level of functioning that you or your kiddo has been diagnosed with. So we have high functioning and we have low functioning. It's the inverse. So basically, the low functioning, that's the kiddos and the adults that need a lot of support, and the high functioning don't need a lot of support. And so those are just some of the things that you can be thinking about and asking about with your evaluator. So now what? Recommendations. I just talked about that. You need to ask your evaluator, what do I do first? Therapy is always going to be like the number one recommendation, regardless of your age, because the gold standard for autism is ABA therapy, applied behavioral analysis. That is what it means. And that is really the gold standard. But therapy is going to be at the top of the list typically. And then school supports are also going to be included in there. That is regardless if we are talking preschool all the way to college, because you can get support in college as well. I've helped clients with that. And or grad school if you decide to go back to grad school. Or if your kiddo is planning to do that in the future, that is always an option. There is county support, meaning the Rocky Mountain Human Services, the county that you live in. There is support for that and help there. And then there's online support. There's some really awesome groups out there that get together, and parents of kiddos and adults with autism and grandparents with kiddos and grandparents with, grandchildren, and there's just a whole bunch of different services. And so, again, though, it's very overwhelming when you look at that evaluation and you go, I don't know what to do. Ask your evaluator, they will guide you. And then when you go and sign up for therapeutic services, they will further guide you because they will really break it down for you as far as what's next and what needs to happen. So let's talk about this for a little bit. Autism is a genetic disorder. So it's a neurodevelopmental diagnosis. That's what we technically call it. Neurodevelopmental simply means it's a brain disorder. Okay, that's all that means. And so it's genetic. This is not a parenting style issue. A parenting style is not causing autism. This is not something you did or didn't do when you let your baby cry in the crib. And that's kind of how you were training them. that didn't cause autism, or if you worked and they were in a daycare facility, that doesn't cause autism. And vaccines do not. There's actually a lot of research around that in our field that vaccines are not directly correlated with autism. So giving vaccines or not giving vaccines. Um, Autism really reflects those differences in what I've been talking about. They struggle with communication. And that's both from a speech development perspective, but also from a social interaction perspective. They struggle with social interactions. They feel awkward. They feel different from their peers. That's what I get told all the time is I felt like my whole life there was something wrong with me, and now I know what to call it. And it just feels so good and heavy at the same time because I don't know what to do with it. I hear that all the time, and it's a sensory processing issue. And so they really are on the struggle bus with being able to have different textures and different foods, and it's kind of gross to them. It's like an ick factor to them, right? And so then they just want to like, nope, I'm never eating that again, or I'm never doing that again. That's part of that social interaction where they do all or nothing thinking. It's very black and white. And learning patterns are really difficult for someone with autism because they have those developmental delays. They don't typically struggle cognitively, meaning they don't have a low IQ typically, just so you know. They actually usually have a higher IQ than the average population. But they do struggle with learning patterns because learning patterns requires adaptive and cognitive flexibility. And someone with autism really struggles with cognitive flexibility. And so that's autism. It's genetic and it's a brain disorder. This is not something your parent did to you or something that you as a parent are doing to your child at all. When should you pursue an evaluation? Absolutely today. You shouldn't wait. You get the answer. It might be a tricky answer. It might be kind of hard, but don't wait. Get it right away because the sooner that we get services, the higher functioning you and or your kiddo can be. And that's the goal, is that you're getting the help that you need and you're getting the name, the label. So it's not who you are, doesn't define you, but you're getting the support that you need and the therapeutic support that you need. So first, just take a breath. If your child was just diagnosed or if you were, um, really take a deep breath because again, you may feel relief. Like a lot of my clients are like, oh, I finally know what to call this. Like I finally feel normal. You might feel some confusion though because it's tricky. You might go, well, wait, my kiddo seems perfectly fine. What do you mean he or she has autism? Or my husband seems perfectly fine. Like, what do you mean? There might be some confusion in there and fear and grief. There's a lot of grief in having a diagnosis of autism. I can't tell you how many clients I've sat with as they've cried or parents that have cried because it's a loss of what they thought, right? And that's normal. That's so normal, but it can be validating. And there's hope in autism. That's what I love about working with this population because there's such great treatment out there and you can live a very healthy, high-functioning life, and so can your kiddo. But it's also very overwhelming, like I talked about, because there's so many recommendations on, well, what do I do first? Because I want to get this fixed, right? And it can just be overwhelming having a kiddo or having a spouse or having a sister or whomever in your life with autism. That can just be a very overwhelming feeling because you feel like, they're like it's taking care of another child, or you feel like it's two children sometimes because of some of the behavioral outbursts that can happen with an individual with autism. But number one, all of these feelings are super, super normal. And you can sit with your therapeutic team and you can sit with your evaluator and you can process these feelings. It's super helpful. And with that, I am going to pass the baton to Betsy and her team.
Thank you, Stephanie. You are such a wealth of knowledge and so full of compassion and kindness and support. And so I appreciate you very much. And so thanks for passing it to me. So starting with creating your team of specialists. So just as Stephanie mentioned so eloquently, there are so many support systems out there. And with that, that can be quite overwhelming at the same time. So our hope with this part of the presentation is to really break it down for all of you and help you understand the different avenues, the different support systems that we offer in Colorado here. So with connecting with specialists, so the team may include professionals such as developmental pediatricians, psychologists, behavioral therapists, ABA, PT, ST, OT. And just as Stephanie said, there are a lot of acronyms when it comes to therapy. So we'll be taking some time to break these down and really help you understand. So the next slide here, exploring ST, speech therapy. Also known as speech and language pathologists, they primarily support with communication development, whereas PT, or physical therapy, supports with coordination and motor planning, safety, and strength and endurance. Occupational therapy focus on sensory processing and daily living skills. So there's a lot to consider, and you do not have to do all of this at once. There's some real beauty in taking time to process the news, to explore your therapy options, and understand there are different avenues and different questions that you can ask to help you understand what is right for your child and for your family. So families often begin by connecting with just one or two professionals and gradually building their team over time. They may start with OT, they may start with speech therapy, and many, like Stephanie said, often start with ABA, the gold standard therapy for working with children with autism. So speaking of ABA, this is when I pass it over to Jessica.
Yep. All right, let's talk about applied behavior analysis, or ABA therapy. It's considered the gold standard for supporting children with autism due to its strong foundation in research and evidence-based outcomes. ABA focuses on teaching meaningful, functional skills that help children communicate, regulate, and engage more effectively in their daily lives. It's important to recognize that when a trusted evaluator recommends ABA therapy, that the recommendation is based on clinical expertise and a thorough understanding of your child's needs. Just as families trust the evaluation process, it's equally as important to trust the recommended next steps. We also understand that families may come across mixed or negative information about ABA online. While those concerns are important to acknowledge, modern ABA has evolved significantly. Today's approach is child-centered, relationship-based, and focused on building skills in a way that supports each child's individuality and independence. When implemented thoughtfully, ABA helps children develop communication, emotional regulation, daily living skills, and social interaction. So ultimately supporting greater independence and participation in their everyday environments. Next. So early intervention, it does matter. Early intervention is one of the most important factors in supporting a child's development. During early childhood, the brain is rapidly growing and highly adaptable, which means children are able to learn new skills more quickly and build strong foundational abilities. Addressing concerns early allows us to begin closing developmental gaps before they widen. Skills like communication, social engagement, emotional regulation, and learning readiness are all developing at this time, and early support can significantly change a child's trajectory. Research consistently shows that children who receive early targeted intervention often make greater and more meaningful progress over time. Early intervention is about giving them access to the tools and support they need during the most critical learning period. At the same time, it's important to remember that it's never too late to start services. Progress can happen at any age. However, starting early gives the children the strongest possible foundation and the greatest opportunity to build independence, confidence, and meaningful connections as they grow.
Okay, this slide has a lot on it, our therapy decision tree. So one of the most common questions that families ask is, where do we even start? So this decision tree really breaks this down for us, and there are multiple pathways to therapy, and each one serves a different purpose depending on the child's needs, your family situation, and developmental goals. So I'm going to break this down and start with the upper left circle. And just on a side note, each circle represents a different service model, and these pathways often overlap. So they're not isolated pathways, and that's where it gets a little confusing. So I'm going to do my best to break this down for all of you, and I have a feeling there will be a lot of questions at the end to talk about with this. So again, this really highlights the three primary pathways. And starting with the circle on the left, it is the clinic-based service. And this is the interdisciplinary approach. These are typically structured environments where children receive coordinated care from multiple disciplines. That's where the ABA, ST, PT, OT, they overlap. They are all under one roof. And the clinic space can provide access to specialized equipment, therapeutic environments, etc. The upper right circle is home health services. This second circle represents home-based or home health services. These services occur in the child's natural environment and are often used when accessibility, medical needs, or caregiver coaching are priorities. Then the bottom center is EI, or early intervention, and this is our Colorado state service. This is funded. It's a state-funded program. It provides early intervention and educational services, and these services are typically accessed through state programs. They're often one of the first entry points for families, particularly with children 0 to 3. In the next few slides, I'm going to break these down further and talk about where they're most appropriate, or when they're most appropriate, and when to consider one over the other. Thank you, Haley. Early intervention, EI. As I mentioned, it's one of the first that families often start with. These are state funded, they're typically home-based, and they focus on the caregiver coaching, developmental support, building skills through daily routines. And services may include developmental therapy, social emotional support, speech, occupational, and physical therapy. It also helps families navigate plans for transitions. So as children approach the age of 3, EI really supports with navigating the services and what are the next steps. Our next slide is home-based services. Having therapy in the home is such a great opportunity to work with children in their natural environment. It supports children with their daily routines, works on transitional and environmental supports, and they also offer CNA and caregiver coaching. Definitely helpful when children have medical issues or transportational needs. Clinic-based services. They, as I mentioned earlier, really one of the biggest ways in which clinic-based services stand out is that opportunity for interdisciplinary collaboration. So providing ABA, ST, PT, and OT all under one roof. working with social interaction opportunities, structured learning environments, coordinated work on goals such as feeding and sleep and potty training and regulation. And this interdisciplinary approach really offers that strong collaboration. We're all under one roof and we're collaborating on a day-to-day and hour-by-hour basis. And it allows professionals to view a child through their discipline-specific lens and really work together. So speaking of clinic-based services, Handprints Therapies happens to provide clinic-based services, and we do have a clinic in Lakewood near Wadsworth and 285, and we also have a clinic in Greenwood Village off of I-25 and Arapahoe. We do provide the collaborative interdisciplinary approach to therapy, ABA, speech, occupational, and physical therapy. And we created Handprints with the goal of providing true collaborative interdisciplinary support. And research consistently shows that that interdisciplinary approach is that gold standard for supporting children with complex developmental needs, including autism. At the same time, we recognize that clinic-based services are not for everyone. It's not a one-size-fits-all. And we actually work with quite a few home-based ABA programs, one of whom happens to be here. I saw Alden with Alora Home Health, a wonderful option for so many families. And we recognize that ABA is that clinic-based is not the right fit for every child or family. So we regularly collaborate with many home-based or other programs to help guide families and help them understand what is right for their families and for their children. There's also something I would love to share. I'm not going to go into all of the questions, but there are questions that you can ask when you are searching for ABA programs that are best for you and your family. And I would love to share this with you at the end or in a follow-up flyer, really focusing on questions about quality and philosophy and how our goals developed and how our families involved with the process. What is the level of a BCBA supervision? There's so many questions that we could help you individually help support and navigate in a way that works best for your family. And local resources. There are so many resources here that can support you as you're navigating. And these can include, this is just a handful that we've included here: Rocky Mountain Human Services, Family Voices, Autism Society of Colorado, the ARC, Colorado Children's Hospital, Early Intervention Colorado. So these are just a handful of services that are available to you. And Alexis is going to take it from here with our school supports.
Yeah, so as children reach school age, they might qualify for special education services through their school district. And one common way that those services are organized is through an individualized education plan or an IEP. And an IEP outlines the specific supports, the goals, the services that that child may receive within the school setting. And these services can include speech therapy, occupational therapy, behavioral supports or mental health supports, or specialized instruction. And as parents, they're active members of the IEP team, and they play an important role in helping to determine the educational supports that best meet their child's needs. Connecting with other families and building a support network can also be really valuable after receiving a diagnosis. Parents often benefit from talking with others who have gone through similar experiences and can share practical advice or encouragement and validation. Support networks might include extended family members, other parents of autistic children, support groups, therapists, educators, community organizations. These connections can help families feel less isolated and provide reassurance that there are many people and resources out there to support them along the way.
After a diagnosis, it's very common for parents to put all of their time and energy into their child. And while that comes from a place of love, it's important to remember that caregiver well-being matters too. Self-care doesn't have to mean taking long breaks, going to therapy each week, or finding large chunks of time that may not feel realistic. For many families, especially those with busy schedules, self-care can be much smaller and more manageable. So it can look like taking a few minutes to just step outside for some fresh air and drinking your coffee while it's still warm, asking for help with even just one small task, maybe listening to your favorite songs in the car, and just taking a few deep breaths before going into that next transition. Another really good way is just connecting with another parent who understands what you're going through. Even brief, simple moments of care can help reset your energy and make meaningful difference over time. You don't have to do everything at once, and you don't have to do it perfectly. When caregivers feel even slightly more supported and regulated, it often has the direct impact on their child. Taking care of yourself is not taking away from your child, it's helping you show up for them in a more consistent and sustainable way. So autistic children often have unique strengths that are an important part of who they are. These might include strong interests, attention to details, creativity, or unique ways of thinking and problem solving. Focusing on the strengths doesn't mean ignoring the challenges. It means using what your child already does well as a foundation for growth. A few simple ways to do this are following your child's interest and using them to support learning, joining their play before redirecting, modeling and expand what they're already doing or saying, celebrating the small wins because they really matter, and creating opportunities for interaction without pressure. When we build from strengths, children often feel more confident and engaged, which leads to more meaningful progress over time. The goal isn't to change who the child is, it's to support them in growing and participating in a way that works for them.
Developmental progress can also look very different for every child. Some kids may acquire new skills quickly, while it takes others more time, and they see the more gradual progress. Progress may also appear in many forms, including new communication abilities, improved social engagement, or increased independence in daily routines. It's important to remember that development is not always linear. Children may make rapid gains in one area while needing more time in another. Celebrating small milestones and recognizing each step forward can help families appreciate the meaningful progress that their child is making. Parents often have a lot of questions about what the future may hold for their child. Questions about communication, school experiences, friendships, independence, they're all really common. While it's natural to want clear answers, development can be difficult to predict, especially early in a kiddo's life. Kids grow and develop in ways that may surprise both the families and the professionals. So instead of focusing on predicting the future, many professionals encourage focusing on supporting development, building skills, and creating opportunities for that growth.
A message of hope. So receiving an autism diagnosis can feel overwhelming at first, and families often experience uncertainty about what comes next. And I hope we've given some good tools and ideas throughout our portion of this. And it is important to remember that children with autism, they grow and they learn and they thrive with the right supports. And I love, Jessica, how you focused on the strengths and recognizing those, and with guidance from families and educators and therapists and children can build those communication skills and develop relationships and increase independence and pursue meaningful interests. So our goal is to support families in identifying these strengths and building those skills and helping children thrive in a way that honors who they are.
So about a little bit about Healing Pathways Collective. We offer here evaluation services, and that's from an autism perspective, psychological, neuropsychological. Really, I can do any and all evaluations, but autism, is one of my areas of expertise. We do individual therapy, and we do it for kiddos from 2 years of age and up for all types of different issues, including higher functioning autism. And but any kind of mental health issue, family system issue, we do couples therapy, family therapy. So we're really just kind of the whole gamut of therapy here at Healing Pathways.
One of the most important messages that we want families to take away from this presentation is that they're not alone. There's so many families out there navigating similar experiences, and there's an entire community of professionals, educators, and other parents working together to support people with autism. While the journey may include challenges, it's also going to include opportunities for growth, connection, and meaningful progress. And support systems, services, and communities exist to help families along every stage of this journey.
We mentioned earlier that there will be lots of time for questions and answers, and we've started with this slide because we've had frequently asked questions over the years. So thought we'd start with this, and please think of additional questions. We'd love to answer them later in the presentation. The first one, how do I decide between home and clinic-based therapies? So I had mentioned earlier that it's a tricky decision, and really understanding what is out there for you and meeting with the different approaches, understanding what is a priority for you. The best setting depends on your child's needs and your family's goals. Home-based therapy can be helpful for working on daily routines and skills in a familiar environment, while the clinic often provides that more structured approach and access to a full team, opportunities for social skills, etc. So really meeting with different organizations, thinking about your priorities, and deciding from there. Alexis, how many hours of therapy does my child need?
It's really going to depend on your kiddo's profile, their goals, their tolerance. If a child has a few skills to work on, they may have a focused program ranging from 10 to 20 hours per week, while comprehensive therapy programs can range from 20 to 40 hours a week to target more skills. But recommendations should be individualized and they should change over time. More hours don't always necessarily mean it's better. It's just the right plan for your kiddo that matters most.
How will I know if therapy is working? Jess, would you like to take that one?
Yes, of course. So you should see measurable progress over time. This could be as increased communication, smoother transitions, reduced frustration, and improved engagement. Your team should review data with you regularly and adjust the plan as needed.
The next question, do we have to do ABA, speech, and OT all at once? Absolutely not. Many families start with prioritizing one, maybe communication and regulation, and then layer services over time. So a good team will help you pace your services and understand when it's time to add and work with your family. So the next question, I've heard negative things about ABA. Is it still recommended? Alexis?
Just touched on this a little bit earlier too, and so it's true that ABA has received a lot of criticism, and those concerns are super important to acknowledge. However, we encourage you guys to find programs that are doing modern ABA because it is so different, and it really focuses on building meaningful skills through play and positive reinforcement, and then using cooperation and relationships over compliance. And overall, the goal is to not fix a child, but to support them in their communication, their regulation, and participating in their world in a way that feels safe and authentic to them.
How long does ABA last? What a great question. Jess, would you like to do that one?
Sure. ABA is not a one size fits all timeline, so progress looks different for every child. So some may need short term support, while others benefit from longer services. The focus is on steady, meaningful progress and adjusting the goals as the child grows, not meeting a specific time frame.
What role do parents play? Caregiver involvement is one of the strongest predictors of progress. So, parent coaching helps strategize and carry into daily routines so skills generalize beyond therapy sessions. It is vital having caregivers involved and able to carry through the recommendations. And the last one on this slide, what do I look for in a quality ABA provider? I touched upon that a bit earlier. And Alexis, can you expand upon that one?
Yeah, so a few highlights for those is looking for programs that are individualized. Treatment plans shouldn't be a one size fits all, and it really should be tailored to the person that it's treating. Um, Child-led, so like using their motivation towards cooperation instead of forcing that compliance. Having a BCBA supervisor regularly on site is going to be really important to make sure that all of those treatment plans are actually running the way they should be running. Being collaborative with other services, especially if you have a kiddo who's getting comprehensive plans up to 40 hours a week, it really should be using other therapy services alongside with them. And being respectful of your child's communication and regulation needs. And then overall, really just trusting your instincts. Good providers welcome your questions. They want to hear and they want to know and they want to be able to tell you everything about their program.
The next slide, I think, Stephanie, these are great questions for you to address.
Yeah. So what if I can't afford an evaluation? What if I don't have insurance? Providers do take insurance. There are providers out there that take Medicaid, Medicare, such as us at Healing Pathways. Not everybody does, but try to find that first and foremost. And then secondly, if they don't, do they offer a discount? Do they offer a payment plan? Those are really good questions to ask. And so usually the answer is yes, but make sure they're using the gold standard, those measures, before you're signing up for with them. Okay. Everywhere I look has a wait list. Now what? Yeah, that's a tricky one because it's very true. But not everybody has a wait list. I particularly don't have a wait list here at Healing Pathways, but you just keep calling around, again, looking for those gold standard measures. Is it too early or too late to get tested? Absolutely not. I literally will test someone in their 50s, 60s, someone who is 2, 5, 6, 7. It's just never too late because it really helps you to understand what it is that's going on and how you can get the right treatment and the right help so you can live a just more functioning, just happier life. And you can get your needs met. That's the purpose of getting an evaluation and getting into services. So, what if my child is shy or doesn't cooperate? Well, that's pretty normal, by the way. But individuals that work with kiddos, typically don't have a problem with that. I don't have a problem with kiddos that are shy or don't cooperate. Many of my peers who test for autism don't either. So that's a pretty normal behavior for a kiddo. Just let the evaluator take over and do their job. That would be my recommendation. Can a diagnosis change over time? Does your child end up not having autism? No. Do you as an adult? No. But can you become higher functioning? Yes. And so symptoms can actually be reduced or mitigated and they can become better. But we don't ever, sorry to say, ever get rid of an ASD diagnosis. What services or therapies should we consider after a diagnosis? Again, I can't highlight this enough or stress it enough. Please ask your evaluator, what should I do first? Where should I go? Who should I call? Your evaluator should tell you that, okay? And that is, those are, I should say, the services or the therapies that you should do. So whatever your examiner evaluator says, I would absolutely follow their recommendation. Should the rest of the family start therapy? Yes, that is part of recommendations, is we always recommend family therapy. It's really helpful for the family system as a whole to understand the diagnosis, understand how it's going to show up, understand what to expect, and then they get tools to actually help mitigate and to soften some of these behavioral maybe outbursts that are happening, or this all or nothing shutdown, because that is definitely something that happens with individuals with autism. And really, it's just overwhelming. And so it's a great place for y'all to just like process the grief and the confusion and the fear and all of the wonderful feelings that come along with it. Will an autism diagnosis help my child access therapy and services? Absolutely. As soon as you have it, you are in, and you are in for as long as you need to. That's kind of the beauty of what Betsy and her team does. And they create this lovely plan for clients, and they work them through, right? This plan. And the goal is that they don't need therapy anymore. But they're also not going anywhere, and it's not a rush. It's never quick. But you get the services that you need. So that ends our presentation. We are going to open it up to, this is our roadmap and everything we covered. We're going to open it up to questions. So please unmute yourself and ask away. And I'm going to take a peek in the chat and see if there's anything in there that needs to be discussed. But please ask any questions, or if you just have thoughts or feelings or any statements about it. That's why we're here. Please use us. We are absolutely here to help you.
And Stephanie, while you're looking at the chat, I wonder, Haley, if you could show the next slide. This is us, and Handprints on the left. I can't stress enough. We want to be a resource, and our referral coordinators are incredible. So calling Handprints, asking about any of the services that we explained, speech, PT, OT, ABA, home-based, clinic-based, EI, etc. We really want to be a resource. And so you can feel free to call our intake coordinators. And then, of course, we have Healing Pathways Collective is right here to the right, another incredible resource. And we're all in this together to really help families navigate and find what's right for your individual circumstances. So please reach out to either Stephanie or myself